Hi all, and welcome to the October installment of our virtual CDEV Classics presented by Kaiser Permanente. CDEV Classics provides monthly health and wellness activities to Santa Cruz County residents. My name is Alyssa Beaton, and I'm the Public and Community Relations Manager with the Santa Cruz Warriors. Today, I'm here with Kaiser Permanente's Dr. Kendra Chun as we discuss breast cancer health and awareness and celebrate October's Breast Cancer Awareness Month. Dr. Chun, thank you so much for being here today. Before we get started with the Q&A, can you give viewers a little insight into your background and kind of the day-to-day operations of your role?
Sure. Thanks so much for having me. First of all, I'm really excited to share some information with you and the audience. So I grew up in Northern California in the Bay Area. I went away to do my training, but always wanted to come back because my friends and my family are here. I've started with San Jose Kaiser, and I've been here a little over 20 years.
Awesome.
I do all types of surgery. I'm in the general surgery department, so I'll do things like hernia surgery, gallbladder surgery, but I do specialize in breast and skin cancer. So that's the majority, about 60% of the patients I see.
Wow, awesome. So, and kind of jumping right in, can you give us a little background on breast cancer as a disease? Who does it affect most? How many cases are diagnosed each year? Just kind of a snapshot into breast cancer overall.
Okay. So it is the most common, well, second most common cancer for women, and worldwide, skin cancer being the first. It is more prevalent, of course, in women, though men can get it also. There's about a little over 2 million cases diagnosed a year in the world, and about 300,000 in the US. And unfortunately, as the US, we're in the top 5 of diagnoses each year. So about 1 in 8 or 13% of patient or a woman will be diagnosed with breast cancer over their lifetime. Luckily, most of the time it is caught early, so it's very treatable and has a 99% 5-year survival rate for most patients. We do see it in men sometimes in transgender patients, but definitely women and older women are the highest risk.
Wow. So in kind of talking about prevention of breast cancer, can you talk a little bit about what's important to know and steps that you recommend in terms of prevention?
So there are some things that are in our control and some that aren't. So definitely prevention is the best, so that you never get breast cancer or any kind of cancer. So some things that a patient can do is not smoke, have a healthy low-fat diet, exercise regularly 3 to 4 times a week is what I recommend, and really minimal alcohol intake. Red wine is good for your heart, but it's not good for breast cancer. So special occasions, I tell patients definitely they should go ahead, but not a glass of wine every night, in moderation. There are other risk factors. I think we're going to talk about this in a little later, that aren't in your control, but we can talk about that a little bit. So since prevention isn't always possible, early detection is the second most important step you can take, and that's with mammogram. Mammogram is proven to save lives. It's not the funnest procedure, but it is not especially invasive, and it is helpful. So that's what I recommend patients do, a mammogram, depending on their age, how often depending on their age, it would determine how often we recommend that.
Awesome. Can you talk a little bit about what happens after that mammogram, after the breast cancer screening?
Sure. So the mammogram is done. Typically in our system, the patient, it's read the same day, and the patient will receive the letter usually within a week, just depending on the rate of the mail, how fast or slow it is. But if the radiologist sees something that they think is new or unusual, they might recommend a follow-up study in 3 to 6 months, depending what it is, how big it is. If they're worried about it, if it looks something suspicious, they'll probably have the patient come back and do more imaging, like an ultrasound, maybe an MRI, and maybe even a biopsy, depending what they see in that further imaging. And if the biopsy is abnormal, they will send the patient to the breast cancer clinic, and we'll evaluate them and discuss that with the patient, decide what needs to be done next.
Gotcha. Great. So, you kind of alluded to it earlier, but in thinking about family history, can you kind of talk about that importance when it comes to breast cancer and really cancer overall?
Mhm. So most breast cancer is not genetic. People worry, they say, oh, my mom had it or my aunt had it. And most breast cancer is not genetic or hereditary. That only counts maybe for 20% of breast cancer cases. So family history is important. If I have a patient that has a lot of people in the family, especially first degree relatives, then we will potentially have them do more imaging, start imaging earlier, or refer them to the genetics department to see do they need genetic testing to take a look at what might be going on? Why is there so much cancer in their family?
Gotcha. Great. So then in kind of talking about, reducing risk, what are some things that can help reduce the risk of breast cancer and maybe even, cancer overall?
hmm Yeah, there is a lot of overlap between different cancers and things you can do, and unfortunately, a lot of things aren't in our control. So risk factors for breast cancer, smoking, obesity, high-fat diet, sedentary lifestyle, family history, previous radiation, maybe if they had lymphoma or breast cancer in the past. So those are some of the risk factors. So a lot of those things, being a female, being older, over 50, those are risk factors, and a lot of those aren't in our control, unfortunately. But in general, I tell people, low fat diet, minimal alcohol intake, exercise. Those are and mammogram. That's not necessarily prevention, but that's early detection, which is
Right.
really important too.
Awesome. So, you talked about it earlier, but breast cancer can affect both men and women. So, what are some things that men in particular, some steps that maybe they can take in regards to breast cancer prevention?
So it only affects well, of all breast cancer, only about 1% is diagnosed in men. And they're not getting mammograms regularly at all. So they tend to present with a lump or a skin change. So I would say a male should, not be embarrassed or not be shy to step up and say something to his primary care doctor if he notices a new lump or bump or something that's unusual or discharge. And we'll work it up actually with the mammogram, possibly an ultrasound biopsy. And most of the time it's not cancer, but we want to be safe. And same thing for women. They need to be their own advocate. If there's something that doesn't seem quite right, they notice something new in the skin, or the nipple becomes inverted, or a new lump or bump and it's not going away after a week or so, they should definitely say something to someone because we want to work it up and see what's going on.
Great. Well, this has been very informational, but just one last question. If viewers or listeners were looking to get, additional resources or more information on breast cancer prevention or, the disease as a whole, do you have some resources or places that they could go for that information?
Yeah, things have changed a lot. It used to be when I first started practice, the Dr. Susan Love book was like the mainstay in it, but it's huge. It's like this thick, and it's a better doorstop really than bedside book. So now we have the World Wide Web at our fingertips, which is great. But I would be careful in terms of, you don't want to look at a blog that just anybody put out there. So American Cancer Society is great, has a lot of resources and information. They even offer rides for patients that have problems with that. An overnight stay, if let's say you live far from the hospital, you're going to need to go to the radiology center. National Breast Cancer Foundation is a good website, and Cancer Care Point for patients that live in the Bay Area. That is over on the border of Los Gatos and San Jose, and they offer a lot of classes, information, handouts, and support. And then kp.org is a great source, and you don't have to be a member to get that information. And it's you just go and click on different things. You can listen to our speakers, look at articles. There's a lot of stuff on that too.
That's great. Thank you for that. Well, thank you all on behalf of the Santa Cruz Warriors and Kaiser Permanente for joining our CW Classics discussion on breast cancer awareness. And thank you, Dr. Chun, for joining us and sharing your expertise and insight with us.
Of course. Thanks for having me.
Sure. And the CW Classics have activities the last Monday of every month. For more information, visit santacruzbasketball.com/classics. Thanks, everyone.